Well, November is Diabetes Awareness Month, and get this, more than 133 million Americans are living with diabetes or pre-diabetes.
Wow, that is a lot. Joining us now to talk about this disease and how to prevent it is Dr. Raul DeVroy from Intermountain Healthcare. Great to have you, doctor.
Thank you guys so much for having me.
Thank you so much. Let's tackle this subject. It's a big subject. It affects so many people. How do you exactly define diabetes, and who do you think's most at risk for getting it?
Absolutely. So diabetes is a chronic or long-lasting medical condition that affects millions of Americans, like you guys pointed out. What diabetes is actually a problem with our body in order to metabolize the sugars that we take in from our diet and convert it into energy in our cells. People with diabetes have a problem in this conversion step, leading to the glucose levels being higher in the bloodstream. When this sugar level is high in the bloodstream, it leads to problems, unfortunately, all throughout the body. Like you mentioned, 133 million Americans suffer from this, and even 96 million Americans suffer from what's called prediabetes. Now, with diabetes, there's certain populations that are at higher risk. This includes people who are overweight or obese, as well as certain ethnic groups, including African Americans, Hispanic Americans, Asian Americans, Native Americans, and Pacific Islanders.
Wow, that's interesting. And what's crazy is there are different types of diabetes, like you mentioned. What are those different types?
Absolutely. So classically, when we think of diabetes, there's type 1 diabetes, type 2 diabetes, and something called gestational diabetes, and the pre-diabetes I'll mention a little bit about too. Type 1 diabetes is classically found amongst younger children. It's a genetic condition that's passed on, and so patients often don't have insulin in their body at birth. It's diagnosed really early in childhood. Classically, sometimes it can present later. Now, for parents who have kids with this, there's no blame or anything to be put on anyone. It's a genetic condition, so it's just important to get plugged in with your pediatrician. Now, contrast this with type 2 diabetes. This typically presents a little bit later classically in life. You think of the young adult, an adult, and as well, a little later in adulthood. Now, what happens in type 2 diabetes is we have insulin resistance, meaning our body does produce some insulin, but it's not sufficient to control the glucose levels. There's a whole spectrum, so depending on where you are, it's important to get screened and see, so you can use treatments as simple as diet and exercise, or as complex as medications and injectables. The gestational diabetes is the diabetes that's found in pregnant women, and often needs to be controlled and followed by your OBGYN in order to make sure the health of the baby and the mother are taken care of. And then prediabetes is the condition just a little bit before, where you don't necessarily meet the threshold for diabetes, but you're kind of heading in that direction. It's important to follow up with your primary care doctor so they can give you advice, as well as if there's any medications that you need to take.
Wow, doctor, you're a wealth of information.
Yes. I trust you.
Yeah,
I would go to you for everything.
You got this down for sure.
Yeah.
You mentioned prediabetes, and you mentioned kind of those glucose levels get heightened. What are the symptoms? How does someone know?
Absolutely, great question. So there's a lot of symptoms that people can present with. This includes excessive thirst, excessive hunger, excessive urination, feeling fatigued or tired, having multiple urinary tract infections or yeast infections, having pins and needle sensation in your lower extremities or legs, as well as having some blurriness in vision. Occasionally, if you present with a severe presentation, people can actually have some weight loss, rapid shallow breathing, as well as altered mental status or a state of confusion as well.
Wow. Well, I think the big question is, how can we prevent this, or what can we do to kind of prevent for even getting something like this?
Absolutely. So when we think of some of the risk factors, we think of things in prevention, we think about non-modifiable and modifiable risk factors. So some of the non-modifiable things are things we can't change necessarily, our genetics and our family history. And we think about the modifiable risk factors, which are things like weight gain. So some of the things we can do to prevent diabetes include things like being active, living an active lifestyle. You know, take that extra 30-minute walk at the end of the day. Park a little further away from when you're running your daily errands. Incorporating these kind of lifestyle changes will be big. Hand in hand with that is diet as well. Take a hard look at what we're eating. Cut out some of the fast foods, the heavy carbs, the sugars or sweets. Trade it in for something a little bit more healthier, like vegetables, lean meats or proteins, and limiting our carb intake. Apart from that, we can also look at weight loss. So a little bit of modest weight loss is a great starting point. 5 to 10% is kind of what we aim for in terms of weight loss across the board, as well as other things such as following up with your primary care physician in order to get plugged in and screened for diabetes as well.
Speaking of which, and we've almost run out of time, doctor, but real quick, how do you get checked?
So it's important to establish with a primary care physician. These doctors will check your blood levels to see if there's any screening tests or anything else that needs to be done and can give you advice. If you don't have a primary care physician, you can come see us at Intermountain. We have over 30 locations across the Las Vegas area, as well as offer free virtual classes for a lot of our patients.
Oh, awesome.
Wow, doctor, thank you so much. You really laid it out.
Yeah,
thank you guys so much for having me.
It's great to have you. If you would like to learn more, head to intermountain.com/Nevada, or you can call the number right there on your screen.